This CardioMEMS is a small device that is implanted through the femoral route into the posterior aspect of the left lower lung. So it monitors the pressure inside the lungs and is a surrogate for the volume status within the heart. And if the patient goes into heart failure before they have manifested symptoms of heart failure, you're able to adjust the diuretic therapy and keep them out of the hospital. It monitors the pressure all the time within the lung. That's the pulmonary artery pressure. So it communicates with a remote monitor to a database that gives you access every day to the patient's pressure monitoring. So a physician's office can retrieve that information, adjust the medications of the patient so that you prevent patients from having heart failure worsening. If a patient is scheduled to undergo a CardioMEMS device, they need to come fasting overnight to the hospital. The patient is taken into an operating room in which we are able to monitor the pressure inside the heart as well as get angiographic films. That is, we are able to area where we are able to define what the blood vasculature is like. Okay, the patient lies flat on the table. He gets IV sedation. We access the femoral vein, then we pass a pressure catheter inside the lung. We try to go to the left lower aspect of the lung and the posterior part. That means in the back over here. We shoot a venogram in which we define how much the blood vessel size is, and then after that we pass this device into that location and we deploy the device after making sure that it's communicating with the outside monitor. Once that is in place, we get everything out except that little device that stays inside the body. Then we again shoot pressure and cardiac output inside the lung, and then once we have the data, the procedure is closed. The actual procedure lasts about 30 to 35 minutes. Morbidity and mortality associated with the procedure is negligible, and the patient is on his feet in 4 hours time. What you're going to expect as a patient is improvement in quality of life and decrease in hospital admission rates and possibly decrease in mortality. That means the risk of dying goes down, the risk of developing symptoms of shortness of breath, waking up at night because of shortness of breath, swelling of feet is going to go down. The chances of getting admitted to the hospital as a result of heart failure worsening is going to go down. So it'll benefit immensely.